Good evening, everyone, and welcome to our coding guideline party. If you want to keep up
some amazing brightness, it's not distracting
with our upcoming events, please be sure to follow us on LinkedIn, Twitter, Instagram, Facebook, as well as our website. Tonight's winners of today's game will receive a copy of our ICD-10 CM Coding Concepts, a review guide, which is a manual that helps you really reinforce the guidelines. So for tonight's game, we are playing ICD-10 CM Coding Jeopardy. And our categories for today are chapter-specific guidelines 7, 9, 10, 12, and then we have a mystery section. All right, so I am going to start with Markeisha. Please pick a category.
May I have section IC 12 for 300, please?
12 for 300, and 1 moment, please. All right, so section 12 for 300, and of course, because this is a Jeopardy game, your answer should start off with what is. All right, so section 12 for 300, and the question is, pressure ulcers described as healing should be assigned the appropriate pressure ulcer stage code based on.
What is the documentation in the medical record?
And that is correct. All right, 300 points for Markeisha. And we're gonna go right on over to Tina.
Let's see. ICD-10 for 200.
And which section would you like? 7, 9, or 10, 12, or mystery? You want 10?
ICD-10 for 200. Did I understand? Am I not understanding?
So just so everyone understands, the sections across the top actually represent the chapter-specific guidelines. So in ICD-10, there are 20 chapters.
Okay.
So you want section 10?
Yes, ma'am.
All right, for 300?
Okay.
All right, here's your question. Respiratory failure may be listed as a secondary diagnosis if it.
Okay.
And you only have a few seconds to answer.
You're getting me now. Oh goodness.
All right, your time is up.
I'm sorry.
Your time is up. Sheila, would you like to steal this question? And I just gave the answer. What is occurs after admission, or if it is present on admission, but does not meet the definition of principal diagnoses? All right, that's okay, Sheila. It's your turn now. Which category would you like?
7 for 300.
All right, chapter 7 for 300, and your question is, when a patient has bilateral glaucoma and each eye is documented as having a different type and the classification does not distinguish laterality, you should assign one code for.
The type of glaucoma bilateral with the 7th character? I'm not sure.
And the answer is, what is the type of glaucoma with the appropriate
I'm sorry. I keep forgetting I got to say what is.
That's all right. I'm going to go ahead and give you your points for that.
Thank
And
you.
we're going to go back to Markeisha.
Chapter 12 for 400.
Chapter 12 for 400. If the documentation states that the pressure ulcer is completely healed at the time of admission,
What is no code is assigned?
that is correct. All right, 400 points for Markeisha, who has a total of 700 points now. All right, Tina, back to you.
Section 10 for 400.
Section 10 for 400. J95 851, ventilator-associated pneumonia, should be assigned only when the provider has
Ventilator associate should be assigned when.
All right, Sheila.
Fred.
Tina, you ready?
Oh, my bad. You got it, Tina. If not, I'm going to steal it.
I don't want to play with y'all anymore.
All right, Sheila, it is your turn.
Okay. What is when the provider has also documented the presence of the ventilator associated with pneumonia?
I think we'll give you that. You added some extra words. You added some extra words, but we will give you that because this is all about learning. All right, next up, Sheila, it's your turn again.
Okay, I'm going to go with 500, section 10.
All right, section 10 for 500. For patients presenting with conditions related to vaping, assign which code as the principal diagnosis?
What is U07.0?
That is correct. Another 500 for Sheila. On to Markeisha.
Chapter 12 for 500, please.
Chapter 12 for 500. Assignment of the code for an unstageable pressure ulcer should be based on.
What is the clinical documentation?
What is the clinical documentation is correct, and that's 500 for Markeisha. And right now, Markeisha and Sheila are tied. Back to Tina.
Section 7 for 500.
Section 7 for 500. If a patient is admitted with glaucoma and the glaucoma stage progresses during the admission, assign the code for. All right, Sheila. I'm sorry, not Sheila, Tina. Tina, you answer?
What is the code for the highest stage documented?
All right, Tina, you're on the board.
Yes, Jesus loves me.
All right,
Good job, Tina.
Thank you.
Sheila, you are up next.
I'm going to do section 9 for 300.
Section 9 for 300. ICD-10 has combination codes for arteriosclerotic heart disease with.
What is hypertension heart disease?
Somebody want to steal?
I'll steal.
All right, Markeisha.
What is angina pectoris?
That is correct, Markeisha. All right, so
okay.
now since everybody is on the board, I'm going to let whoever wants to answer the question. And so I'm going to randomly pick the categories. Are you ready?
As ready as we will be.
Yes.
All right, first up, I'm gonna go to the mystery section for 500 because my motto is go big or go home. And here's the question. Code assignment is based on the provider's documentation of the relationship between the condition and the care or procedure unless otherwise instructed by the classification. All right, I need an answer. All right, no one got it, and it is, what is complications of care? All right, next up, I'm going to again pick another one randomly, and here goes. When using category H40 glaucoma, assign as many codes as needed to identify.
What is the type of glaucoma, the affected eye, and the glaucoma stage?
That is correct. 100 points for Markeisha. All right. Back to the board, and here's the next question. When a patient has a bilateral condition and each side is treated during separate encounters, assign the.
What is the modifier 50?
No, that's CPT.
Oh, yes, it is. Wow, oh my goodness.
So that is what is the bilateral condition, and in CPT that is a 50, but this is an ICD-10 CM game, so I'm sorry, that won't count. All right, next up, here we go. When a patient has bilateral glaucoma and each eye is documented as having a type or stage, and the classification distinguishes laterality, assign the appropriate. Oh, I guess I got happy fingers today. And the answer is, what is the code for each eye rather than the code for the bilateral glaucoma? All right, okay, I'm gonna move my fingers away from the screen, and here is the next one. If it did occur, code it as confirmed diagnoses. If it did not occur, reference the alphabetical index to determine if the condition has a subentry.
Oh, crud, what is that? That is.
All right, I need an answer.
Crud, what is that one?
All right, guys, here's the answer. What are impending or threatened conditions?
I knew that one. I knew that one. I could not think of the word.
All right, next up. If the documentation is unclear as to whether the patient has a current non-pressure ulcer or if the patient is being treated for a non-pressure ulcer, what should you do?
What is query the provider?
That is correct. That's 200 points for Markeisha. All right. And here's the next category. The codes and categories J44 and J45 distinguish between.
What is uncomplicated cases and those in acute exacerbation?
That is correct for Tina. Okay, next up. Let's see, where should we go? All right, I know where to go. Assign codes from combination category I-13, hypertensive heart, and chronic kidney disease when there is.
What is hypertension with both heart and kidney involvement?
That is correct. 500 points for Markeisha. All right. Next up. Secondary hypertension is due to an underlying condition. 2 codes are required.
What is one to identify the underlying etiology and one from category I-15 to identify the hypertension?
That is correct. That's 200 points for Markeisha. All right. So let's see where we're going next. All right, here we go. A residual effect after the acute phase of an illness or injury has terminated.
What is sequela?
All right, Tina, that is correct. Next up, here we go. If a patient is admitted to an inpatient hospital with a non-pressure ulcer at 1 severity level and it progresses to a higher severity level, 2 separate codes should be assigned.
One code for the site and severity level and of the ulcer on admission, and the second code for the same ulcer site and the highest severity level reported during that stay.
That
That was a
is
lot.
correct for Sheila.
That was a lot.
All right, next up. If a type 1 non-STEMI evolves to STEMI, assign the.
What is the STEMI code?
That is correct for Markeisha. All right, next up. Assignment of the 7th character 4 for indeterminate stage should be based on.
The clinical documentation.
That
What
is
is the clinical documentation?
That is correct for Sheila. All right, next up. 2 diagnoses, or a diagnosis with an associated secondary process, or a diagnosis with an associated condition.
What is combination code?
That is correct for Markeisha. And back to the beginning, and let's see, here we go. If the documentation is not clear as to whether the acute respiratory failure and another condition are equally responsible for occasioning the admission, No one?
What is query the provider?
That is correct for Markeisha. And our last one. The classification presumes a causal relationship between hypertension and heart involvement and between hypertension and kidney involvement, as the two conditions are linked by the term
With, what is with?
that is correct. Actually, you are correct. My answer is wrong, but you are correct. It is what is with. All right, so let me total up the points here. So in first place, we have Markeisha. In second place, we have Sheila. And in third place, we have Tina. But
Congrats, Markeisha.
Thank you. I appreciate it.
But since there are no losers in education, all three of you will get a copy of ICD-10.
Woo-hoo! Thank you.
Yay!
Thank you.
Dr. Campbell.
Lisa. All right, so Lisa, which category would you like?
I'll go with 4 for 200.
All right, section 4 for 200 or 400?
It don't matter.
Yeah, let's go big. All right.
Okay.
Here we go. For patients with secondary diabetes mellitus who routinely use insulin or oral hypoglycemic drugs, an additional category from code
What is Z79.4?
Z79 is the correct category, and I'll just excuse the 4 part because there's a code for insulin and there's a code for the oral, but we still got you on the board. All right. Next up, Destiny, which category would you like?
I'll go section 2, 300.
Section 2, 300. The neoplasm table in the alphabetical index should be referenced first. However, if the histological term is documented, that term should be
Reference first. What is reference first?
That is correct for Destiny. All right, next up, back to Lisa.
Section 1 for 500.
Uh-oh, go big or go home. Section 1 for 500. When a patient is diagnosed with an infection that is due to MRSA, and that infection has a combination code that includes the causal organism, assign the appropriate organism, assign the code for the.
Oh, God.
All right, Lisa, we need an answer.
I don't know.
Destiny, do you want to steal?
Sure. What is assign the appropriate combination code for the condition?
That is correct. That is correct. And let me capture your points. And all right, so Destiny, it's back to you again.
Okay. Let's go section 5, 400.
Section 5 for 400. All right. A disorder in which a caregiver, the perpetrator, falsely reports or causes an illness or injury in another person, who is the victim, under his or her care, such as a child, an elderly adult, or a person who has a disability.
What is, I can't even say this.
Spell it.
Munchausen syndrome.
Munchausen syndrome. All right, that is correct for Destiny. And Lisa, it is back to you.
I'll do 5 for 300.
All right, 5 for 300. A disorder imposed on self or Munchausen's syndrome is a disorder in which a person falsely reports or causes his or her own physical or physiological signs or symptoms.
What is fictitious disorder imposed on another?
That is correct. For Lisa, back to Destiny.
Let's go section 6, 500.
All right. Should the affected side be documented, but not specified as dominant or non-dominant, and the classification system does not indicate a default, guidelines state if the left side is affected, the default is.
Oh gosh, I know this one too.
All right, we need an
Is
answer.
it non-dominant? What is non-dominant?
That is correct. That is
Ooh,
correct. All right, back to Lisa.
I'll do 5 for 100.
5 for 100. Selection of codes for in remission for categories F10 through 19 requires.
What is the provider's clinical judgment?
That is correct for Lisa. Back to Destiny.
Let's do section 4, 300.
Section 4.
Mhm.
Codes under categories E08, diabetes mellitus due to underlying condition, E09, drug or chemical-induced diabetes mellitus, and E13, other specified diabetes mellitus, identify complications and manifestations associated with.
What is secondary diabetes mellitus?
That is correct. All right, back to Lisa.
I'll do 4 for 200.
All right. If the type of diabetes mellitus is not documented in the medical record, the default is.
What is type 2 diabetes mellitus?
That is correct. Back to Destiny.
Section 2 for 500.
Section 2 for 500. When a primary malignancy has been previously excised or eradicated from its site and there is no further treatment directed to that site and there is no evidence of any existing primary malignancy at that site, a code from which category should be assigned?
What is Z85?
Yes, that is correct. It's not detachment, but it is the 85. All right, 500 for Destiny. All right, next up, back to Lisa.
I'll do 4 for 500.
4 for 500. Assign as many codes from categories E08 through E13 as needed to identify.
What is all the associated conditions that the patient has?
That is correct. All right, next up, back to Destiny.
Section 5, 500.
When the provider documentation refers to use, abuse, and dependence of the same substance, how many codes should be assigned? Lisa, do you want to steal?
What is only one code?
That is correct. That is correct. All right.
Mhm.
So next, back to Lisa.
I'll do section 1 for 100.
If a patient is admitted for an HIV-related condition, what is the principal or first listed diagnosis?
What is B20?
Oh, somebody's been memorizing those codes. All right. Next up, back to Destiny.
Let's go section 6, 200.
The default for post-thoracotomy and other post-operative pain, not specified as acute or chronic, is the code for, and that should say you assigned the code for. It's my bad typing.
So what should it say?
It should say the default for the post-thoracotomy or other post-operative pain, not specified as acute or chronic, should be assigned which form of pain, I should say. And I might have to call that a bust because of my bad typing. It should be the acute form.
Oh, okay.
So when it's
Okay.
not specified as acute or chronic, it should be the acute form.
Oh,
All right,
okay.
Destiny, I'll give you another chance.
Okay. Section 6, 100.
Section 6. If the encounter is for pain control or pain management, assign the code from category G89, followed by the code identifying the
Site-specific pain?
That is correct for Destiny, and we are back to Lisa.
6 for 300.
6 for 300. Post-operative pain not associated with a specific post-operative complication is assigned to the appropriate post-operative pain code in category.
What is G89?
That is correct. All right, and back over to Destiny.
Section 1 for 200.
Section 1 for 200. If a patient with HIV is admitted for an unrelated condition, what is the principal or first listed?
What is code for the unrelated condition first?
That is correct. All right, next up, back to Lisa.
Section 1 for 300.
Section 1 for 300. If a patient admission and encounter is solely for the administration of chemotherapy, immunotherapy, or external beam radiation therapy, what should be listed first?
What is external beam radiation therapy?
The answer is all of those Z51 codes. So it should be the Z51 codes, depending on if it's chemo, immuno, or the radiation therapy. All right, next, back to Destiny.
Let's go section 1, 400.
Coding of sepsis requires a minimum of 2 codes, which are
what is the first a code for the underlying systemic infection, followed by a code from subcategory R 65.2, severe sepsis.
That is correct for Destiny. And back to Lisa.
1 for 300.
1 for 300. When is code Z21 used?
What is when the patient without any documentation of symptoms is listed as HIV positive?
That is correct. All right, back to Destiny.
What is section 2 for 200?
When the admission or encounter is for management of anemia associated with the malignancy and the treatment is only for anemia, which code is principal or first listed?
Um, mm.
Mm.
So the appropriate code for the malignancy is sequenced as the principal or first listed diagnosis followed by the appropriate code for the anemia.
So the malignancy is principal.
Okay.
All right, Destiny, we'll let you have that. All right, next up, Lisa.
Section 2 for 400.
When an encounter is for treatment of a complication resulting from a surgical procedure performed for the treatment of the neoplasm, the principal diagnosis is?
What is the complication?
That is correct. All right, back to Destiny.
Section 6, 400.
When an admission or encounter is for a procedure aimed at treating the underlying condition, the principal diagnosis is?
Yeah, you can go ahead and pass that one.
Lisa?
What is the code for the underlying condition?
That is correct. All right, and Lisa, it is back to you again.
4 for 100.
Diabetes mellitus diabetes mellitus codes are combination codes that include all right, we need an answer.
You could pass it.
What is the type of diabetes mellitus, the body system affected, and the complications affecting the body system?
That is correct. And lastly is back to Destiny.
Section 5 for 200.
If both use and dependence are documented, assign only the code for
The abuse. Oh, wait. The dependence. What is the dependence?
that is correct. All right, so let me tally up the points real quick. All right, so the winner is Destiny by 200 points.
Oh, wow.
By 200 points. But you both are winners, and you both will be receiving a copy of the ICD-10 CM coding concepts. Well, guys, that is it for